The recurring shortage of medical drugs has become a major impediment on the daily operations of the hospital's vital services, leaving most patients untreated. The issue seems to have no end. Professor Mola says as a result of this, patients have been advised to seek treatment at private hospitals or pharmacies.
Busy, and we just order the drug. Go to Stella Martin on one in a dispensary in the house, and then there's no medicine there. And then the people in the dispensary say, "Oh, you go along city pharmacy and buy Stella Martin," and then they haven't got the medicine, they haven't got the money, and then they don't get treated. Well, they're going to die in the house, or they're going to come back and be dead on arrival or something. So often the doctor who is seeing the patient in the first instance and trying to get the diagnosis right, order the right medicine, etc., they don't see the death.
The ongoing shortage of medical drugs has even put more pressure on doctors and nurses as they try to use what's available to treat patients.
But it also affects doctors' and nurses' lives because we're there trying to treat the patient and we order the medicine, and then 10 minutes later someone says, but there's actually none of that medicine in the first. We have to go back and see the patient again and then try and work out, is it an alternative possible, or do we have to send the person to a private retail pharmacy, and then we have to quiz them, have you got any money? Oh my goodness, it makes our job so much more complicated, and we have to do the same things over and over again. So it really puts a big burden on the health staff as well, this kind of shortages.
Professor Mola has alleged that the present procurement system is corrupt and needs to be changed.
This government seems to have more of a political will to get it right. But if one thing which is causing them an obstacle is contracts that were signed by the previous government. You can't break contracts easily. If you do, you have to pay them out, and we haven't got money to pay them out and then have money left over for new contracts. So an obstacle is that all these contracts have to run the course, like the expiry date of our contracts, so it's the Kenya. And as soon as these contracts run out, I think they will run out this year. Usually the contracts are either 12-month contracts or sometimes 2 or 3 year contracts. The government will be able to put a new system in place. We need a new system, and we must have a system that somehow gets the corrupt people out of the middlemen, the corrupt middlemen out of the system.
Stella Martin, NBC National News, Port Moresby.